The app is something that we have developed in partnership with Ontario. There were a number of decisions we had to take. We had to wait for Apple and Google to update their operating systems so that they could do the Bluetooth handshakes in the background that the app relies on. Many of the other apps tried in other jurisdictions like Australia and Singapore required a level of activity in the front of your phone that meant even people who downloaded it didn't, often use it to its full capacity. So we were reliant on the operating systems to be updated. As that happened, we then worked with experts from BlackBerry and Shopify and others to make sure that the code was right, did a significant amount of beta testing, and now Ontario is ready to move forward. It's our largest province. They have done extraordinary work in creating those links with their public health system. Across the country, now what is needed to happen, and we're looking at the Maritimes next and a number of other provinces that are working very hard to align with this, is they have to make sure that their provincial and territorial public health agencies have the ability to give to anyone who tests positive a code that they can then input into the app so that the system knows that their phone has tested or they have tested positive. Again, this is a situation where I would want to know, people will want to know if someone who they came in contact with over the past few days suddenly tested positive. They don't need to know who, and there's no privacy information shared in this. But you will know if someone you were in proximity with over the past 2 weeks has suddenly tested positive for COVID, you'll get a notification that says you should now call your local public health agency and ask for guidance on the next steps. But in order to be able to do that in each province, we have to coordinate with the local public health agency to do that. And that's what we're working on now that we have the system up and running in Ontario, in our largest province. It will hopefully be up and running for local public health agencies right across the country in the coming weeks.